Hey everyone, I'm Ryan Nord, an ear, nose, and throat doctor specializing in treating obstructive sleep apnea. Now, if you clicked on this video, you may be like many of my patients. You have sleep apnea, you've tried the typical treatments, but they haven't really worked out for you. You've probably gone online and looked for some other options, and maybe Inspire popped up as a possible option. But what is it? And more importantly, is it for you? Well, today I'm going to try to demystify that for you a little bit and tell you my 5 things that you should think about if you're thinking about getting Inspire. Hypoglossal nerve stimulation. The hypoglossal nerve is the name for the nerve that controls your tongue. So this system has been FDA approved since 2014 to treat moderate to severe obstructive sleep apnea in those patients who are unable to tolerate the typical treatments like CPAP. It works inside your body by using the natural processes to keep your airway open. It delivers mild stimulation to the key muscles, such as the muscles of the tongue, to pull the tongue forward with each breath, allowing the airway to remain patent during sleep. It's a 3-part system that's put in through 3 incisions. You can see the device here. The main part of the device is the battery that sits just below the collarbone. The battery does not have to be recharged, and it lasts for approximately 11 years. Underneath the battery is a breathing sensor that goes between the muscles of the ribs and monitors your breathing so that the stimulation can be timed with your breathing to optimally opening your airway. Then there's a small cuff that goes from the battery all the way to the neck, and that cuff wraps around the hypoglossal nerve, which again is going to control your tongue. So this 2-incision surgery is completed in about an hour and a half with minimal downtime and generally acceptable recovery. The sleep remote seen here is how you control the device. You simply turn it on wirelessly and go to sleep, and after about 30 minutes it will turn on, and every time you take a breath in it will sense your breathing and pull your tongue forward to open up your airway. This is a medical diagram showing how this device works. The cuff here is showing the stimulator being placed around certain nerve branches. And this is really the key to success of the surgery. The cuff has to be placed so that the only nerves that are stimulated are the ones that are going to stiffen the tongue and pull it forward. In contrast, we don't want to stimulate the nerves that are going to pull the tongue backwards because that would be bad for keeping your airway open at night. Here's some figures showing the actual effect of the Inspire device on your airway. On the left-hand side is a picture of airway collapse at the back of the tongue, and similarly here a picture of complete collapse at the level of the soft palate or the soft part of the roof of your mouth. In this same patient now, the Inspire device is activated and you can see the tongue base open readily with each breath. And this activity goes up to the soft palate as well, and so it works on more than one level to cause the airway to open at night. Number 1 on my list of top 5 things to consider if you're considering Inspire is what I'm doing now working? That's a question you should ask yourself. Are you using CPAP, an oral appliance, even positional therapy? And is it helping you? If the answer is yes, then no, you don't need Inspire. That's a really important point, and a lot of people come to my office and they don't maybe appreciate that or fully understand. They might think that it's a choice. CPAP's working out for me, for instance, but I don't like taking it on the plane, or it's uncomfortable, but I can't sleep without it. I need it every night. I use it 6, 7, 8 hours a night, and I feel rested. I'm feeling good. If that's you, then likely Inspire is not for you. It's really for people who are not doing well on their current treatments. If you're using an oral appliance, you've worked with a dentist, you've gotten it fitted, it seems to be treating your symptoms well, and you've had a sleep study showing that it's working. In that case, if everything's going great, then no, you don't need Inspire. Number 2, the next thing you need to know is, am I a candidate, or am I likely to be a candidate? Again, you're not going to be a candidate if you're using CPAP and tolerating it. The second thing to consider, which is really important, is what is your body mass index, or BMI. That is essentially a number that is your weight relative to your height. And I'm going to show you how to calculate that really easily. Go to Google, type in BMI calculator, and navigate to the CDC's calculator. Simply put in your height and your weight. We'll use 5'10" and 220 pounds. Hit calculate, and then you'll see here your BMI comes up. In this case, it's 31.6, which would be well within the range for Inspire. But depending on your insurance, that number needs to be either below 32 or for some insurances below 35. Importantly, for Medicare-aged patients, if you're 65 and older and are on Medicare, likely, as long as your BMI is under 35, you should be good to go. For people with commercial insurances, younger people, many commercial insurances are going to require your BMI to be under 32. So that is important. If it's over that, you're going to have to lose the weight first, and there's typically really no way around that. Next, and this is kind of a technical point, and I don't want to get too much into the details, but it's really important. This Inspire procedure is for people with moderate to severe sleep apnea. And you can know that by looking at your sleep study. The way we would determine how severe your sleep apnea is by looking at that sleep study and looking at a certain number called the AHI. That's the apnea-hypopnea index. It's just a number of how many times per hour you're either stopping breathing completely or partially. That number needs to be above 15 but below 65. Of course, there may be exceptions, and certainly you can fight with the insurance company on this. But typically, if your sleep apnea is mild and less than 15 events per hour, you're probably not going to be a candidate for Inspire. So it's good to know that going into all of this. Next, of course, there's the airway exam, or the drug-induced sleep endoscopy. I'm not going to talk about that too much right now, and I'll definitely put another video up on that later, so make sure you click that subscribe button, and I will go into all the details on that. But just know, after the consult, if you do look like you're a good candidate, the next step is going to be a short endoscopy procedure where your doctor looks in your airway when you're sleeping and snoring to see if the type of collapse that's happening in your airway is the one that is favorable for Inspire. The third thing you need, a recent sleep study. If you are kind of rummaging through the trash, looking at your sleep study, maybe it's 7, 8 years old, you need a new one. It needs to be within 2 years, and it can be either a home sleep study or an in-lab, but it can't be an old one. So get that updated sleep study. Number 4, know the risks. This is just part of being an informed consumer. There are some risks to the surgery, and you should be aware of them. Thankfully, the surgery is quite safe, but the complication rate is anywhere from around 1 to 4%, depending on the source you look at. If you want to do some more research into complications, you can Google the Inspire Patient Experience Report and pull that up. And you'll find that this actually shows all the complications that have been reported. This is a really transparent report. You can look here, for instance, looking at per year. So in 2018 versus 2019, 2020, showing the freedom from Inspire revisions. And what this means is that in 2020, over 98% of folks are free from having to have any revision up to 20 months after implant. And you can see that over time, from 2018 to 19 to 20, the procedure continues to get safer and safer. So again, low complication rate. You can delve into some of the details here. It's a very thorough and transparent report, and I think it'll be helpful for anyone looking to get a little bit more information. Number 5, the last thing is to know what your goals are. Are you going to be satisfied with nothing less than 0 sleep apnea, no snoring? I mean, yeah, that's great, but most of the time it doesn't happen. So the results are that on average, your apnea index is going to go down by 70 to 80%. That means that if we're looking at 100 people, some people might go down by 100%. Some people it may go down by 50%. There's a range. Rarely you may not improve at all. And so it's always a risk, and just like any surgery, there's not a guarantee. Well, I hope you enjoyed watching this video, and now you're a little bit more informed, and at least you have the 5 questions that you need to ask yourself before you get your Inspire consult. Thank you so much. Please subscribe because I have a lot more content coming your way. Sleep well.